I found out I had cancer in the summer of 2003, and I was very scared and because I was only 39. So I was a mother with younger children, and I was very worried about the future.
It was in 1959 when I had a dark mole on the inside of my ankle, my left leg, and there was a growth underneath the mole. So I went to the doctor, and they removed that, but it kept coming back over a period of 5 years. But I would assume that in the meantime, the molecules of cancer had started to move around my body, and it started in the prostate.
En 2007, j'ai appris que j'avais le cancer et la réaction, c'est que je ne croyais pas du tout. Je pensais que c'était une farce, mais c'était vraiment pas une farce. Et puis, elle m'a vraiment dit « Vous avez le cancer ». Le cancer de l'ovaire. Au début, en 2007, ça a été le cancer de l'ovaire. Il procédait à l'opération. Je l'ai appris au mois de mai et j'ai été opérée au mois d'août.
I first learned I had cancer in February 2010, and it's non-small cell lung cancer, to be very specific. So it became all of a sudden, it jumped to a stage 4 cancer, and I was with my wife that day, and he's telling us this, and he says, "I'm sorry to say that there is no cure for this." And that's what the killer, that floors you when you hear that. But they've been taking very, very good care of me.
Yeah, I didn't know exactly what was going to be involved in clinical trial. I was just kind of going with the flow, so to speak. I knew I had cancer, and I thought, well, participating in the various studies and so on, it's going to benefit me plus other people. So I adapted myself to it, which wasn't much of a problem.
J'entendais parler souvent des protocoles de recherche, tout ça. Et puis moi, bien, étant donné que par la suite, j'ai eu le cancer du côlon et que je suis en récidive du cancer du côlon, on a décidé d'y aller parce que c'était fait pour moi, cancer du côlon avec métastase. Et quand j'ai lu le protocole, j'étais très fière de voir ça parce que je me disais, c'est mon traitement.
My thoughts on clinical trials are that without them, we're not getting anywhere fast. And they're absolutely necessary. It's something that some people actually are worried about taking because they don't really understand how the trials work. But there's a big benefit to these clinical trials. There's more than one, but one of them is that you're getting seen much closer. So they're paying very close attention, monitoring you constantly. So you're getting scanned more, you're getting checked more, because they don't want anything to go wrong, because this is a trial, okay? And the other benefit is if you happen to fall on the good one that's happened to be new and it works, you're one of the first ones.
Well, when you deal with cancer, it's obviously very difficult on everybody. It's the patient itself, the spouse or the partner, and the family, and even the friends. It's this feeling of helplessness. But when you participate in a study like this, you're actually feeling more reassured because the people that you're dealing with are very warm and generous and very friendly. People at the Bronfman Cancer Center have been amazing. My contact there, her name is Audrey, and she's an amazing lady. Audrey and I have been dealing with each other for almost 2 years. And she will call me at home to follow up if she can't see me when I'm in for tests or whatnot. She will, come and see me in person. It's at a point right now where she feels like a part of the family.
Le protocole fait qu'on est suivi de très près et on a des gens qui s'occupent de notre dossier en recherche. Ils prennent tous les tests et puis ensuite de ça, aux 2 mois, on a des CT scans qu'on passe. Ça marche par cycle. À tous les 2 cycles, on passe des CT scans puis je vois déjà un résultat. Ils sont toujours là pour nous aider, en sens qu'ils nous posent des questions. Est-ce que ça va bien? Y a-t-il quelque chose qui ne va pas? On a toujours une personne à rejoindre du protocole de recherche si on a des questions à poser ou si on a des inquiétudes.
I'm all for clinical trials, and my personal experience proves that. I'm glad I did because I think I would be a lot worse off than I am now as far as the prostate bone cancer is concerned.
It's been a very wonderful experience. It's actually been very healthy for me to have as much information as I'm getting from them, and the Bronfman Center has been, their staff, I can't say enough about them. They were just great to deal with.
They're very patient care, they have a lot of empathy, a lot of so many other services other than saying, okay, they're taking care of your physical problem, because they take care of your emotional problems if you have them. They have psychologists that deal with people taking oncology. Their oncology department is outstanding, really. And it's taking care of every little thing around you other than the cancer that you have, because there's a lot of things that get affected when, you know, when you're taking chemo or when you've been told you have a deadly illness or something like that.
Je suis très contente de participer à ce protocole de recherche et très satisfaite. Le personnel de l'hôpital est fantastique, exceptionnel. Ça part des gens de bureau, des secrétaires, des bénévoles, les médecins, les infirmiers. Et dans la salle de traitement, c'est magnifique. Ils sont vraiment là pour nous traiter d'une très belle façon. On est choyés.
And we're very fortunate. We're very fortunate to have the Bronfman Institution clinics here in Montreal. That's going to it has put Montreal on the map as far as cancer treatment is concerned.